Welcome back to World Spotlight TV. Today we will talk about the new Langya virus that has infected dozens in China. Before continuing, please take a moment to like, share, and subscribe to this channel. After COVID-19, now a new virus emerging from China. Will this be a new global pandemic after COVID? COVID-19 hasn't ended yet, and here's another new virus found in China. The novel Langya Henipavirus, LAV, was found in 35 patients in the Shandong and Henan provinces. Many had symptoms such as fever, fatigue and a cough. They are thought to have contracted the virus from animals. There is no evidence so far LAV can transmit among humans. One of the researchers, Wang Linfa from the Duquesne U.S. Medical School in Singapore, told China's state-run Global Times that the cases of LAV found so far have not been fatal or very serious, so there is no need to panic. However, Mr. Wang said, there is still a need to be alert as many viruses that exist in nature have unpredictable results when they infect humans. The scientist said LAV was found in 27% of shrews tested, suggesting the mole-like mammals may be natural reservoirs for the virus. About 5% of dogs and 2% of goats also tested positive for it. Taiwan's Center for Disease Control said on Sunday it was paying close attention to the development of LAV. LAV is a type of Henipavirus, a category of zoonotic viruses which can jump from animals to humans. Some zoonotic viruses can be potentially fatal to humans. These include the Nipah virus, which has periodic outbreaks among animals and humans in Asia, and the Hendra virus, which was first detected in horses in Australia. Other related Henipaviruses have also been found in shrews, as well as bats and rodents. A new type of animal-derived Henipavirus, also named Langya Henipavirus, or LAV, that can infect humans has been found in East China's Shandong province and central China's Henan province, and has so far infected 35 people in the two provinces, according to an article published in the New England Journal of Medicine, NEJM, by scientists from China and Singapore. The new type of Henipavirus was found in throat swab samples, from febrile patients in eastern China with a history of contact with animals in recent times, according to media reports. Scholars who participated in the study pointed out that this newly discovered Henipavirus, which may have come from animals, is associated with some febrile cases, and the infected people have symptoms including fever, fatigue, cough, anorexia, myalgia, and nausea. Further investigation found that 26 out of 35 cases of Langya Henipavirus infection in Shandong and Henan provinces have developed clinical symptoms such as fever, irritability, cough, anorexia, myalgia or body pain, nausea, headache, vomiting. Henipavirus is one of the important emerging causes of zoonosis in the Asia-Pacific region, Shanghai-based media, the paper.cn reported, noting that both Hendra virus and Nipah virus from this genus are known to infect humans with fruit bats as the natural host of both viruses. Henipavirus can cause severe disease in animals and humans and are classified as biosafety level 4 viruses, with case fatality rates between 40 to 75%, according to the data from World Health Organization, highlighting that this is much higher than the fatality rate of the coronavirus. However, there is currently no vaccine or treatment for Henipavirus, and the only treatment is supportive care to manage complications. The cases of Langya Henipavirus so far have not been fatal or very serious, so there is no need for panic, said Wang Linfa, a professor in the program in emerging infectious diseases at Duquesne U.S. Medical School who was involved in the study, adding that it is still a cause for alert as many viruses that exist in nature have unpredictable results when they infect humans. No significant spatial or temporal clustering of Langya Henipavirus has been found till now, meaning that human-to-human transmission of the virus has not been proven, although previous reports suggest that the virus can be transmitted from person to person. Coronavirus will not be the last infectious disease to cause a pandemic worldwide, as new infectious diseases will have an increasingly greater impact on human daily life, Wang Xinyu, Deputy Chief Physician at the Department of Infectious Diseases of Huashan Hospital affiliated to Fudan University, said. Wang emphasized that the scope of this type of disease should not be limited to human diseases, but should be considered in a broader context, noting that the concept of One Health, proposed by several international organizations in recent years, is a suggestion and method aimed at sustainably balancing and optimizing the health of people, animals, and ecosystems. How can we protect ourselves and others? How can we prevent viruses? Here are some tips. Viruses are spread a multitude of different ways, mainly through droplets in the air when an infected individual coughs or sneezes. Some viruses can live on surfaces for 24 hours or longer. By touching desks, doorknobs, cups and other everyday items, we can inadvertently contribute to the spread of viruses. How to prevent viruses from spreading? Some steps you can take to stop or slow the spread of viruses and illness include: 1. Wash hands frequently, for at least 20 seconds, especially after sneezing, coughing, wiping the nose, touching doorknobs, going to the bathroom or leaving places such as your pediatrician's office and daycare center. 2. Use hand sanitizers or alcohol hand rub when soap and water are not available. 3. Avoid contact with people who are sick. 4. Stay home when you are sick. Children and adults who are sick should stay away from public places. Usually once a child's fever is gone and energy level is up, he or she can return to daycare or school. 5. Avoid touching your eyes, nose and mouth, especially with unwashed hands. 6. Encourage children to cover their mouths and noses when coughing or sneezing to decrease the number of germs in the air. 7. Keep the air in your home clean by using a HEPA filter, a device that can remove 99% of pollen, dust, dander and bacteria from the air. 8. Sanitize kitchen sponges and dishcloths, where the greatest concentration of germs can be found. Washing these items in the washing machine or dishwasher does not do enough to kill all the bacteria. Instead, wet the item and heat it in the microwave for 2 minutes. I sincerely hope you enjoy this video. If you have any requests or recommendations, just leave a comment below. Don't forget to like, share and subscribe to this channel.